Hi everyone, my name is Trevor Gordon. I do the communications with the Canadian Epilepsy Alliance. Today is SUDEP Action Day, so we have a special guest with us that we're going to talk about SUDEP. But before I introduce our special guest, I do want to acknowledge that today is SUDEP Action Day. SUDEP Action Day is dedicated to raising awareness of epilepsy deaths worldwide. Launched by SUDEP Action in October of 2014 as SUDEP Awareness Day, SUDEP Action Day shines a light on the largest cause of death in people with epilepsy and helps empower others through increased awareness. SUDEP Action Day is also a day when epilepsy organizations across the world come together with one voice and one united aim. We must encourage every person with epilepsy, their families, and health professionals to be more aware of risks and to take an active role in discussing, reviewing, and reducing them. So today again is SUDEP Action Day, and today we are actually having a conversation with Dr. Elizabeth Donner. And while we wait for her to join us, I would like to read her bio. Dr. Elizabeth Donner is the head of neurology and the co-lead of the Gary Hurwitz Center for Brain and Mental Health at the Hospital for Sick Children, Bloor View Children's Hospital, chair in Pediatric Neuroscience, and professor of pediatrics in the Temerity Faculty of Medicine at the University of Toronto. Elizabeth's clinical work is focused on the medical, dietary, and surgical treatments of drug-resistant epilepsy in children. Dr. Donner leads a research program focusing on identifying those most at risk of sudden unexpected death in epilepsy, SUDEP. Dr. Elizabeth Donner has a strong commitment to epilepsy advocacy in the professional and lay communities. She's also the co-founder of SUDEP Aware, a non-profit dedicated to SUDEP awareness. She's the co-chair of Partners Against Mortality in Epilepsy. She's also the lead of ECHO Ontario, Epilepsy Across Lifespan. So I am honored to have a conversation with Dr. Elizabeth.
Hi, Trevor.
Hi, how are you?
Great. How are you?
Good. I really appreciate you doing this with us on SUDEP Action Day, and I know you're a very, very busy individual, so I really appreciate you doing this with us today.
It's my pleasure. It's an important day, and this is a really nice way for me to recognize it. Live from the clinic at SickKids. So
Yes. Well, thank you. So I'll start off by saying that 4 years ago, you were kind enough to do an interview with Cynthia Milburn, the Canadian Epilepsy Alliance past president. During that interview, she asked what was your message to those who are afraid to talk about SUDEP. I would love your answer to that question today, and to also share with us if you think things have improved in the past 4 years.
So there is maybe a few different categories of people who are afraid to talk about SUDEP. Some of them are people who are living with epilepsy or who are affected by epilepsy. My message to those people is that you can't modify your risk unless you know more about it. And the only way to know more about it is to talk to your healthcare provider, to talk to the other support people in your life. So for people affected by epilepsy, either in themselves or in a loved one, until we start talking about this, we're not going to get on top of it. And for healthcare practitioners, healthcare providers, people working with people with epilepsy who are afraid to talk about it, for that my answer is really clear, because there's lots of data to suggest that people living with epilepsy and those caring for people living with epilepsy want to know about SUDEP. They want to learn about it early in their epilepsy journey. They want to hear about it from their healthcare providers. And when we as healthcare providers don't provide that information, they go get it somewhere else. And I know we're on Instagram today, but we also know Instagram and Google and social media is not the place, other than maybe right now and talking to you, Trevor, is not the place to get your epilepsy information. And so as healthcare providers, we are definitely the right people to provide that information for people living with epilepsy. And so don't be afraid to talk about it.
I
Do think
agree.
it's getting better. I have to say, I think it's getting better. There's quite a few initiatives that I'm involved in that we just see gaining more and more voice and more traction. So I think it's improving. Still work to do, but it's definitely better than when I started in the field.
SUDEP occurs most often at night or during sleep.
Mm.
What are some new technologies researchers are working on to monitor nighttime seizures?
That's a good question. It's a tricky one, but it's a question we get very frequently. So first of all, we know SUDEP occurs most often either at night or from sleep, as you mentioned. And there's a little bit of information to suggest that if someone attends to a person who's had a seizure, that reduces their risk of dying. So that means that if someone has a seizure and I can go to them and be with them and keep them safe, probably reduces SUDEP risk. And so what we're now looking for are ways to let people know that someone's had a seizure. I am a pediatric neurologist, right? I work with kids who have epilepsy and their families. And so for me, that's not so hard to talk about because all the kids that I know with epilepsy live with adults and adults who love them and care about them and are passionate about keeping them safe and going to them. And so for people for whom there is someone nearby, they can use different types of wearable devices, kind of like smartwatches. They can use sensors that go under the mattress that alert when the bed shakes. They can use video devices that pick up when the body moves and alarm a nearby or linked device like a smartphone. And then that person wakes up and goes and checks on the person. Those devices, though, are limited because, first of all, you have to wear it or turn it on or be in the right space. Like for a video, it only works if you're in the view of the video. For a watch, it only works if you're wearing the watch and the battery's charged and you put it on right and you linked it to a phone. And so there needs to be someone, you need to be using it right, and there needs to be someone to answer it. And so it's still a bit of a limited technology, but it's to the point where we generally do recommend that if it's going to be something feasible for people, that they consider using a seizure alarm for people who have frequent seizures at night, and particularly those full body shaking seizures, what we call generalized tonic-clonic seizures.
I apologize if I sometimes ask similar questions, but it's just sometimes just to get like a specific quote
Maybe
from you.
maybe I didn't answer it right,
No,
Trevor.
no, you did. I did, but
Okay.
no, you've been great. Thank you. Basically, also, how would you recommend families and patients select the right device for them?
Oh yeah. That's a great question. It's a really good follow-up question, Trevor. So you need to select a device that suits the person, the lifestyle, the wearer, and also suits the seizure type. So we're starting to have good devices that can pick up on whole body shaking seizures because those devices are activated by like muscle movement of the arm or heart rate changes because when you have a big seizure, your heart will beat faster, things like that. We don't have good devices yet for seizures that don't involve kind of the whole body shaking or changes in heart rate and breathing. And so if the type of seizures you're trying to pick up are seizures you and I know about where people have staring off spells, become unresponsive, those type of seizure devices aren't going to really meet. Or aren't really going to pick up. So the first thing is to figure out, is there a device for my seizure type? And then after you've figured out that, is this device going to actually trigger for someone to respond?
Right.
So that's kind of the first place to start. There's also considerations like cost. There's considerations like kind of comfort and socialization of it. Some people don't mind wearing a watch. Some people don't want to have a video camera in their bedroom. Some people don't want to have a sensor under their bed. So it needs to work with people's lifestyle, or they won't use it, or it's not practical.
So you pretty much answered my next question of the pros and cons of using a seizure detection device, but would you add anything of the pros and cons of using a specific seizure detection device?
I think we have to remember that all of these seizure detectors, First of all, there's quite a few on the market that have not been proven effective. So I'm really going to encourage people to do their homework, maybe talk to their healthcare provider. The organization Danny did has a really good website that goes through all the different seizure detection devices and includes some videos about how they work and some expert testimonials. But the other thing is that sometimes seizure detection devices can actually give a false sense of security, because we know, and we're talking SUDEP Action Day, so we're talking here about sudden death and epilepsy. We know that sometimes people die of SUDEP not after a big shaking seizure, so it's not a guarantee, unfortunately.
When will using, oh sorry, I apologize, I misquoted. Will using a seizure detection device reduce the risk of SUDEP? Where can someone learn more specific? Well, you kind of answered that, Danny.
The answer is no. Like, we have no evidence of that. And it's not that people doing research and developing these devices don't want to show that they could reduce the risk of death. It's that there's really kind of no way to show that, because SUDEP is not that rare, but it's pretty rare, right? 1 in 1,000 people per year who are living with epilepsy will die of SUDEP. So, excuse me, if you wanted to figure out whether a special smartwatch could reduce the risk of SUDEP, you would need to give a lot of smartwatches out to a lot of people and monitor them for a long time to notice a change in the rate of SUDEP. So it's really almost impossible to do that study. And that's why we don't have any evidence that these devices are going to reduce the risk of SUDEP directly. But what we do know is that going to a person after a big seizure, particularly one that happens at night, seems to reduce the risk. And so could a seizure detection device help with that? Probably it could.
Many researchers are working on devices that can detect seizures more accurately and alert their caregivers if needed. What are the kinds of biosignals researchers are using to measure SUDEP risk?
Yeah, we talked a little bit about that. So they're not measuring SUDEP risk with those devices, right? They're measuring seizure. So we can measure movement, that's called accelerometry. We can measure heart rate, breathing, oxygen levels in the blood. And those are some of the ways, also kind of changes at the skin level, kind of skin sweating. Those are some of the ways we can tell if a person's having a seizure. What we don't know is, what are the actual predictors of SUDEP? Goodness, if we knew for sure the predictors of SUDEP, we'd be really moving along. There's some really interesting science trying to look at that, though. There's a few different kind of tools we have that we can look at that. For those of you who are living with epilepsy, you know, you've probably had some brain scans in the form of probably an MRI of your brain, and you've probably had an EEG looking at your brain rhythms. So what scientists are doing is looking at the brain scans and the EEGs of people who have died of SUDEP and comparing them to the brain scans and EEGs of people who have not died of SUDEP, to try and look to see, are there some biological signatures, or sometimes we call those biomarkers, are there some biomarkers of SUDEP that we can identify in people? And then ideally you would identify these before a person dies, and we would be able to tell people, you seem to be at higher risk of SUDEP because of that. And so we think you need to intervene this way. Now, I want to hijack the conversation for a minute, because I want to make sure that people know that we do know ways to reduce SUDEP risk. So even though I'm not sure exactly what the MRI pattern is or the EEG pattern, we know how to reduce SUDEP risk. And the way to reduce SUDEP risk is to have fewer seizures, particularly fewer whole body shaking seizures, and particularly fewer seizures at night. Okay. And we know how to do that, right? We work with our healthcare teams, take medications as prescribed, consider other therapies. Please consider surgery if it's an option for your epilepsy. Surgery is life-changing for people with epilepsy, brain surgery for epilepsy. There are dietary treatments for epilepsy. All these ways will reduce SUDEP risk by reducing the frequency of seizures.
How are researchers assessing the personalized risk of SUDEP? What about if a patient has a rare type of epilepsy?
Good question too. And some of that is work that I'm quite interested in and that we're trying to do in my research group here at SickKids, which is identifying some subpopulations of people with epilepsy who seem to be at higher risk. So there are some genetic epilepsies where people have a gene mutation that definitely is causing their epilepsy and maybe for some reason is increasing the risk of SUDEP. You know, we have these channels or openings in our cells. We have those in brain cells and we have those also in heart cells. And when you have a genetic mutation in one of these channel genes, they can cause problems with seizures when they're in the brain. And when they're in the heart, they can cause problems with heart rhythm. So maybe there are some conditions where people have a heart rhythm problem and a brain rhythm problem together. And maybe those people would be at more risk of SUDEP because of the heart problem coexisting with the brain problem. So actually, some of the work that I'm doing with my research team here at SickKids is to try and understand that by studying people with those really specific epilepsies and looking at not just their brain rhythms, but their heart rhythms.
To kind of sidestep a little bit to just more ask a
Sure.
generalized question about going to a neurologist, what advice would you
Okay.
offer to someone going to see a neurologist for the first time or even the 100th time?
Oh, yeah. In general or about SUDEP?
Yeah, maybe both, but in general, I would say, because I mean, I asked this question because epilepsy
Yeah.
organizations get that question a lot about what to do when they go to a neurologist, or even maybe they went to a neurologist many times and they get a little nervous or they get a little
Yeah.
overwhelmed. Like, what advice could you offer someone going to that first appointment or even to a follow-up appointment?
It's a great question, and I think it probably applies to anybody living with a chronic disease or chronic disorder. One of the first things to do is before your appointment is to think about what you want to get out of that appointment and write it down. And this applies to all of us before we go into something, right? Maybe I should have written down a few things, Trevor, before I joined you here online today. We want to keep in mind what our questions are and what we want to get out of the appointment. So I think you want to come in with a list. If possible, you want to bring someone with you because we never hear everything our doctors say to us, right? And we want to be able to check back with that person after to make sure. The other thing is, and I'm going to speak specifically to SUDEP right now, and there's a really neat new online toolkit, and maybe Trevor, you can post about it after that Preventing Epilepsy Deaths toolkit, which has on it a page for patients or people living with their epilepsy or their families that outlines ways to have the conversation around how to keep yourself safe with epilepsy. And I think it's doctors and nurses and nurse practitioners, healthcare providers' job to bring that up, but we really appreciate it when patients bring it up too, and they say, "How can I keep myself safer?" Right? And it's not just from SUDEP. There's other hazards or dangers associated with epilepsy. We know that. We know that people with epilepsy are 10 times more likely to drown than people without epilepsy. And most of those drownings happen in the bathtub. We think we're telling people not to take baths, but they're obviously still taking baths. So, what are all the ways you can keep yourself safer? I hope that's a good start to your question,
No, that's
Trevor.
good, and I appreciate you sharing that resource. I will add that to
I'll
the
send it to you
caption.
after if you don't
I
have it.
appreciate that. It is important that there is a day to raise epilepsy for SUDEP. I know it sometimes creates a bit of fear for those living with
Mm-hmm.
epilepsy. I know a lot of epilepsy organizations today. There's 26 across Canada.
Yeah.
Of course, we're wanting to raise awareness on this day, but sometimes it creates a little bit of fear. What would you say to a person living with epilepsy worried about SUDEP today and other days of the year?
Well, I have to start with epilepsy in general. I mean, one of the biggest challenges that I see for people is how out of the blue epilepsy is. And we don't know when a seizure is going to strike. And that makes it very unexpected. And if you're living with epilepsy, you're already living with that. And you've figured out, I hope, or you're working on figuring out how to live your life with that unexpected seizure, with that, turn in the road. And the more you know, the more you can help yourself. So please just face the risks and ask your team what you can do to reduce your risk.
How can those who unfortunately have lost a loved one to SUDEP participate in SUDEP research?
Oh, so there's a few things. First of all, the North American SUDEP Registry, of which I am a part, we're a research group. We gather data on people who have died from SUDEP, and you can go to our website, and we will post that after too, Trevor, and you can share information about the loved one who's passed, and you can even, in some instances, donate tissue, be it brain tissue or other tissue, to help scientists to understand more about what happens when people die of SUDEP. The other thing I'll make a plug for is the Partners Against Mortality and Epilepsy meeting. We meet once a year. We are an interdisciplinary group that includes people who are living with epilepsy, people who are bereaved by epilepsy, who have lost a loved one to epilepsy, doctors, scientists, advocates like yourself, and we meet in person once a year, and we have a full day-and-a-half conference all about mortality in epilepsy and death in epilepsy and what we can do as a community. And there are webinars throughout the year with education for families and for scientists and doctors. So we will post that too. Trevor, we're gonna have to post a lot of stuff after this, but we'll do our best.
Well, first of all, thank you. But before I forget, I want to take a moment also to shout out Allison for the Epilepsy Foundation,
Yay.
who actually gave me a lot of these questions. I don't want to claim I'm worded some of
Thank
these
you,
questions.
Allison. I know Allison. She's great too.
Allison gave me some great questions. I snuck in a few of my rookie questions in there. But I thank you, Allison, for Epilepsy Foundation. She put together with her colleagues a SUDEP toolkit, which I know you've been in part of in that toolkit. But I want to thank you, Dr. Elizabeth Donner, for doing this, because this is a busy day for you. Every day is a busy day, but I really appreciate you doing this. I'm going to give you the final words. Is there anything you'd like to leave us with on this day?
Especially on SUDEP Action Day, we touched on this, but people need to talk about SUDEP. I think that using our voices is the best tool we have to reduce mortality in epilepsy. So use your voice and talk about SUDEP.
I thank you so much.
My pleasure.
These answers that you gave were, really helpful and really appreciative. And it's just, again, SUDEP doesn't seem to get talked about enough. And I like how you break down some of this information in ways that we can all understand, because a lot of information can be overwhelming, but you really give a soothing voice to a very important topic.
Thank you, Trevor. I'm happy to chat about it anytime.
Thank you for your time. Thank you.
Take care. Bye-bye.